San Diego, as we know, because of our reporting, has been especially hard hit by the flu this season. The latest numbers put cases over 10,000 with 91 deaths. Joining us with some insight as to why is Dr. Sabrina Fabi. Dr. Fabi, thanks for being here.
Thanks for having me, Jen.
All right, so every year lots of flu strains circulate. Today, the CDC said the H3N2 strain is the one that's been the most prolific. What do we know about that strain in particular and how it compares?
Well, what we know about this strain is that it tends to be a little bit more aggressive than other strains, like the H1N1 strain that we experienced last year. And so this year, because we've been vaccinated to get this particular strain, we have actually seen that it's only about 10% effective. Now, when we speak about effectiveness with vaccines, specifically the flu vaccine, something normal would be between the range of about maybe 10 to 60%, with last year's flu vaccine being up to about 42%. And so this is quite low compared to previous years.
Okay, so, when we do these stories, we keep repeating the health department's kind of mantra of like, still get your flu shot. But to me, that doesn't really make much sense if it's only 10% effective. Why still get the shot?
Well, they're saying that this is basically statistics that came outside of the U.S. The U.S. is actually saying that it's about 32% effective. So the thought is that if you can at least be protected 32% of the time and basically decreased your risk of hospitalization and even possible death. Because remember, San Diego County has already experienced 91 deaths up to this point, then that's better than nothing, especially with young children. And also because if you're carrying that virus, for instance, then you put others at risk, like pregnant patients, children, babies, as well as the elderly, who are much greater risk of the complications from this virus.
As we were looking at some of that video there, I often wonder, flu vaccine, I'm sorry, not the vaccine, but the flu itself is airborne, right? In fact, even in our newsroom, people are sick and everyone's like, go home if you don't feel good.
Right.
What other things do you recommend from people to do? We talked about the Tamiflu shortage. Is that something people should start as a preventative?
Probably not so much preventative, but it does mean that if you start having symptoms, you should get tested right away. They've actually set up a tent in front of Sharp because they were testing for this, because if you get tested and it comes back positive, then within 48 hours, you can basically take Tamiflu and you will have more efficacy from the treatment. After those 48 hours, it's just not as effective, and that can mitigate some of the symptoms from the flu, which is why it's important to get tested right away.
Well, the flu typically peaks in February. This year, they're saying it's peaking right about now. I guess we can hope maybe that's the good news, and then we can see some relief from this. Dr. Fabi, thanks for your time. I appreciate it.
Thanks for having me, Jen.